recording for us. Perfect. So tonight we're going to hear from Dr. Robin Arthur, and then the department chair for the Department of Clinical and Health Information Sciences, Dr. Pam Greenstone, who's on. She'll offer some closing remarks just about why we wanted to do this and what the department's up to. So we're excited to have both of them here. So as the screen says, a couple of housekeeping notes. I'll kind of be on the mute patrol to make sure we don't have any feedback. If you have any questions for Dr. Arthur, go ahead and just put it in the chat, and Pam will help us moderate toward the end. In the last few minutes, we'll have time for some questions. And if we don't get to it within the hour, we'll follow up with you individually to make sure your questions are answered. So we'll try to end right at 8 p.m. just to be respectful of everyone's time. So with that, I'm going to introduce our speaker. So Dr. Robin Arthur is a Bearcat. She received her BA in psychology from UC, her master's degree in industrial and organizational psychology, and her doctorate in clinical psychology from Xavier University. Her postdoctoral studies were in neuropsychology at UC as well. She was on the team that built the Linder Center of Hope Mental Health Hospital in Mason, Ohio, and served as their chief of psychology for 9 years. She was on faculty at UC in the College of Medicine for 12 years as well. And currently she is the CEO and managing director of Transform Consulting LLC. And she's actually going to start publishing her online webinars and podcasts this coming January. So more resources from her are going to be available. So we'll, in the follow-up email, make sure the links to her organization and those resources are in there, so you can follow up and join her email list and just keep getting amazing resources from her. So we really appreciate her time. So I'm going to stop sharing my screen so she can pull up her slides, and hopefully that works for us. So welcome, Dr. Arthur.
Thank you. I am a Bearcat. I've actually been a Bearcat since I was 8 years old, and I started training to be a professional ballet dancer at CCM. So I spent 10 years of my life at CCM and danced with the Cincinnati Ballet Company. So, and my dad was a Bearcat, my kids are Bearcats. So even though I got my doctorate at Xavier, I think I still bleed red. So anyway, so I'm happy to be here tonight. I really like talking with people in any area of the medical profession about work-life balance and how to handle stress, but particularly right now, because I'm going to show you some statistics about how severe it's gotten in our worlds. I've been in healthcare since I was about 21, whether I was a medical secretary, a medical transcriptionist, I was a medical assistant for a while I was going through my school to get my nursing degree. And then I left healthcare thinking it was too stressful, and I did my master's in business psychology and did a lot of work in the business world. And then I really missed patient care. So I came back and did my clinical work, and I'll always be a clinician in healthcare. So it's a really noble calling for all of us in healthcare, I think. So thanks for being here today. I will try to stay interesting and engaged with you and not have technical difficulties. So I don't want all of you to just take a minute and think about your stressors right now. We're not going to share these. I just want you to have them first and foremost in your mind, and then write down a couple of things you worry about currently, and then rate them on a scale of 1 to 10, 10 being the most severe stress in your life for right now. And just keep that handy for yourself. It's really for you as we go through this. So I want to talk about the stress cycle that we all experience. When we start having a stressor, in the first seconds, your brain signals your adrenal glands and it starts releasing adrenaline. After 10 minutes, the stressor might subside, but the cortisol keeps pumping. And then hours go by and the threat is past, but the cortisol is increasing your insulin and other hormones. And after a week, chronically elevated cortisol can make you pre-diabetic. After 2 weeks, you start having hormonal changes, and after 6 weeks, you have weight gain and illness. And the reason I bring that up is because of the levels of stress that we're all having in our lives, particularly since the pandemic. It's really important that we do everything we can to get into work-life balance and to manage our stress. Because what happens is you have stress, then you have distress, and then you have disease. And my goal as a health psychologist and as a former nurse and working with people in the healthcare environment is that we avoid having health issues, because we know that all of our mental health issues and our physical health issues, pretty much most of them start with stress. So these are some of the behavioral things we do when we're stressed: overeat, skip meals, lay awake at night, irritability, fatigue, and then increased anxiety and depression. Our psychological symptoms are forgetfulness, anger, frustration. You can see more drug use, more irritability, feeling powerless. And hopefully by the time you get to the end of this, you're going to see some things that you will empower you to manage your work-life stress, isolation, problems with your work and schoolwork. And then it affects your body, as you can see all the changes that happen in your body. So we know that things that happen with our immune system, our cardiovascular system, neuroendocrine, central nervous system, they all are started with stress. So if we can manage our stress, we can keep ourselves healthy, psychologically and physically. So here's some of the statistics I pulled up just in the healthcare environment. So it is a high stress environment. Anybody who works in healthcare realizes that. I can tell you that in my private practice, I'm seeing more nurses and doctors than I have ever seen in my 20 years of working as a psychologist, because of the environment that they're working in right now. And as you can see by these statistics, we're stretched out and we're stretched too thin and we're stressed. 93% of all healthcare workers are stressed. Okay, 86% have anxiety, 77 frustration. And that's what I'm really hearing: the frustration, the exhaustion, the burnout, and feeling overwhelmed. I mean, it's not a small issue and it should not be ignored. I'm I'm heartened to hear that a lot of hospitals are working hard right now to really help all of their employees deal with the stress. But the reality is healthcare is stressful no matter what, and it's especially stressful right now. And not getting enough emotional support. So 39% of healthcare workers said they did not feel like they had adequate emotional support. And then emotionally and physically exhausted. So when you look at these numbers, and when I look down at the bottom, especially where I see physical symptoms like headache, stomach ache, questioning your career path. I hate when any healthcare providers start questioning their career path, because I think we all go into it for really special reasons. But the compassion fatigue, I'm really hearing a lot in healthcare, is that it's really hard to be compassionate when you are so stressed and when your work-life balance is out of balance, basically. So all of these things I just showed you on these last two slides are why I think it's really important for us to talk about work-life balance and stress management. Common mental health issues that we see when your work-life balance is off are things like depression and anxiety, substance abuse, and substance dependence. So abuse is, I drink alcohol and I drink too much, but I don't need alcohol all the time. Dependence is, I need alcohol all the time and I'm an alcoholic and I need it every day and I can't go without it. So we're seeing a lot more abuse, fortunately, than we're seeing dependence, but it's definitely an issue. And not just alcohol, but drugs and other things too. And then I always, whenever I'm presenting about mental health issues, I'd like to talk about symptoms versus illness, because just because you have anxiety does not mean you have an anxiety disorder, or just because you have symptoms that look like depression does not mean you have full-blown depression. So symptoms are present in all of us. They're caused by what we call the biopsychosocial system that we all live in. So our biology, our psychology, and then our social environment all affects us. And when we move into an illness, it's because whatever the symptoms are, they're interfering with our ability to work, they're interfering with our relationships, and they're interfering with our leisure. So as Freud said, our ability to work, play, and love is inhibited when we have an illness. And if you get to that point, that's when you really need to seek help. So again, symptoms versus illness is important to remember. So you can take charge. All of those things I just showed you are just a snapshot of what's going on when you're out of work-life balance and when you're stressed. But what I really like to stress is that there are many things you can do in your life right now and that you have to make a commitment to. So early intervention is best outcomes, no matter what, whether it's that low level of stress whether it's a low level of a mental health issue coming on, the sooner you start getting help for your either personally, you doing it, or reaching out for help, the better. So waiting is not a positive thing. Okay. I like it when people come into my office and they're like, I'm just not really sure. And I say to them, yep, you don't have a mental health issue, but you're headed that way. So let's take care of it now. So you have to make a commitment to change. Okay. I can promise all of you watching, no one is going to sit you down unless you're in a severe state and say, you really need work-life balance. We all talk about it. It's out there, but to really make it happen is only going to come from inside of you. And you can encourage your peers as well, but you have to make that commitment that I'm going to be more balanced in my life because I don't want to have all the physical and psychological things that happen and the relationship issues that happen when I'm not in balance. So we can reach out to our social support system, and we can be a social support to our peers working in healthcare. And we can engage in meaningful activities, and we can have good lifestyle habits. And that's where I'm going to spend the rest of this presentation, is talking about your lifestyle habits. Because if you put the things that I present next into place, your work-life balance will be better and your stress levels will be significantly lower. So hopefully, when you look at the stressors I asked you to write down at the very beginning, and you see on a scale of 1 to 10, if you're at 5 and above, you need to start doing the things I'm about to talk about tonight. As soon as you're off of this presentation, and you need to make a commitment to doing it for the rest of your life, basically. So, okay, so here's our areas we need to focus on in our life. Okay, only you can prioritize these things in your life. You need to think about, for you personally, which of these is most important to you, and how much time will that receive from you. So we have our vocation at the bottom, our careers, and then that a lot of times leads into the financial part, our avocation or our hobbies, how we spend our leisure time, our relationships, our physical health, and then spirituality, whatever that means to you. All of these things interact. But a lot of times when we're out of balance, what gets the most attention is our vocation, sometimes our relationship. And if we're not paying attention to all of these things, we're going to feel out of balance. And I can tell you from my personal experience and from that of the people I work with, when you get balanced again, you can't stop you. You can take on the world. When you're out of balance, you feel like you're climbing an uphill battle. So think about these areas of life and how much time you're giving to each of them right now. Okay, so the first lifestyle characteristic I want you to think about is exercise. And I know we all hear how important exercise is, but 20 to 30 minutes a day is a minimum of what we should be doing. You don't have to do that all at once. You can break it up. You can do 10 minutes in the morning and 10 minutes at lunch and 10 minutes in the evening. And that's doable. It's not overwhelming. Okay. I want all of our lifestyle changes to feel like I can do this. I can put it into my life right away. And I don't want to neglect it ever again. So a single sweat session equals that your immunity fires up. And so your killer T cells go out and they act like green berets, and they start protecting your body and protecting your immune system. And every workout you do will stockpile protective cells. And that's really important. Even 10 minutes of exercise, you're stockpiling protective cells. It also stimulates your B cells. So your T cells and your B cells will work together, and they will keep your immune system healthy and fired up. And boy, we need that now more than ever. So exercise is not a small lifestyle change that you need to make. It's probably one of the most important things. The second one is sleep. So 7 to 9 hours of sleep on your circadian rhythm. So there's a doctor, he's called the sleep doctor. And for the life of me, I could not remember his name. But if you look up the sleep doctor, he'll come up. His first name is Michael. And you take a little quiz. I always love to take little quizzes. You take a little quiz and it tells you what animal you sleep like. So like for me, I sleep like a bear. So I like to fall asleep between 11 and 12 at night and get up between 7 and 8 in the morning. And because I'm self-employed, I can do that now. When I wasn't self-employed, I could not do that. And I always felt like I was dragging. So you need to figure out what is your circadian, like dolphins only sleep with half of their brain asleep. Some people are like that. So they never feel like they fully slept, but because that's their sleep schedule, they wake up happy and ready to go. So if you're interested, look up the sleep doctor and take his quiz. So if you can, wait to drink caffeine in the morning. We get up. I'll be honest with you, I don't do this. I'm really bad at this. I need that cup of coffee sitting on my nightstand. And fortunately, my husband has it waiting for me. But really, what they say is you should wait an hour before you drink your coffee because your body needs to wake up, see some light, get moving, and then give it some caffeine if you still need to. So avoid that alcohol late at night. Do intermittent fasting. So it's a big fad right now, intermittent fasting. Well, it actually helps your sleep schedule too, and it helps you get a better night's sleep. And set your routine before you go to bed at night. We really sleep best in a really cold, dark room. So set your thermostat down as low as you're willing to set it so you get a really good night's sleep. And before you go to bed at night, make a gratitude list. 3 things you're grateful for the day. It resets your brain into a positive mindset, and then your dreams will be healthier and happier too. If you go to bed worrying about things, you will dream things that you worry about. If you do a gratitude list before you go to bed, you're much more likely, and research shows this, to get a good night's sleep. So, and if at all possible, take the screens out of your room, including your cell phone. Put your cell phone in another room if at all possible. Use an alarm clock if you need a clock to get up. And when I work with teenagers, I'm like, no cell phone in the room at night. And they're like, but I need my clock. I need it to wake up. I said, no, you don't. They've made alarm clocks long ago and they still exist today. So if at all possible, get rid of the screens in your bedroom before you're going to sleep. So sleep, very important. Sleep, inadequate sleep is one of the causes for mental health issues that's not talked about enough. So as a mental health practitioner, we are constantly telling people you have to get 7 to 9 hours of sleep because when you do, your depression level goes down, your anxiety levels go down. So do not underestimate exercise and sleep as 2 of the most important lifestyle changes you can make. So this is very, very hard in healthcare, but I'm going to put it out there anyway. You have to look for a work schedule that supports what you consider your non-negotiables in life. And hopefully your non-negotiables in life, if they're not already, they will become your self-care, your relationships, and professional results. And they will all get your attention. Because what we frequently do is we overwork and we neglect the other things. I am working with several people in healthcare right now who are ready to get divorced because they did not pay attention to this. And I will absolutely honor the fact that in healthcare we overwork. We work very long shifts. We feel like we need to keep giving and giving and giving. And if you're in healthcare, you're a giver already. But you have to give back to yourself too. Your work has to be balanced. Okay. I read a book. Michael Hyatt has an organization called Business Accelerator that I'm a part of. And I get nothing by promoting him, but he just released a book with his daughter, Megan, and it's called Win at Work, Succeed at Life. So if you're going to pick up any book to help you be balanced in your work, this would be one I would absolutely recommend. It's very easy to read. It's not very expensive, and it covers a lot of the things I'm covering right now, but it really encourages you to look at how to win at work and also succeed at life. Because oftentimes we do one or the other, but we don't balance them well. So I highly recommend this book. I brought it, being the psychologist geek I am, I bought it for all my family members for Christmas, but please don't tell them. So every year they get some kind of book, and this is the one they're getting this year. So I really want my family to win at work and succeed at life and be balanced as well. So, and several of them work in healthcare. So, all right. Here's another one, nutrition. Again, I'm preaching to the choir probably on a lot of these things because we're all like, yeah, I need a healthy diet, I need to get exercise, all of these things. But what I find when I go out and I really talk to groups of people is they're not doing it. Okay. We're not prioritizing ourselves. And I can't say it enough times in this presentation. You must prioritize you. I studied with Deepak Chopra, who comes from India, and he and all the people I know say in Eastern cultures, they are taught to take care of themselves first so that they can go out and take care of everyone else more effectively. Okay. I want us to bring that motto too. And I want us to teach this to our peers, to our family members, to our spouses, to our significant whomever, that if you take care of you first, you are much more effective at taking care of other people. So that's why I consistently say, take care of yourself, take care of yourself, take care of yourself. And I do practice what I preach because I had a time in my life when I was not taking care of myself and I had a major health incident. And it was absolutely related to the fact I was working 60 or 70 hours a week and I was not taking care of myself. And that was a major eye opener to me. And so all of these things I'm teaching you, I put into my life and I've never had that health issue again. And I'm convinced had I not practiced what I preached, I would have that health issue again. So, so when we look at nutrition, excuse me, the Mediterranean diet is absolutely the best diet you can follow. Now, that's unless you have some kind of health condition where you need to follow a special diet. But just by and large, all the research in the world teaches us that the Mediterranean diet is extremely healthy for us. So we want to be right now, especially with stress, we want to be adding in as much vitamin C through our foods if possible as we can. So eat fruits, peppers, broccoli, cabbage. All of those are great sources of vitamin C. That's not to say taking supplements is bad, but everything you can get from a whole plant-based diet, you should try to get because it's much healthier for you. Vitamin D. Vitamin D has been shown to be linked to a lot of autoimmune diseases, the lack of vitamin D. So if you fall short on vitamin D, you're putting yourself at a much higher risk, and especially for something like multiple sclerosis. There are many research studies that show that people with multiple sclerosis had very low levels of vitamin D in their system when they were diagnosed. So I tell, and heart issues linked to vitamin D. Your brain needs vitamin D. I can't stress vitamin D enough. It comes from the sun, and we wear sunblock, so we don't get as much vitamin D as we should. So it's again, it's associated with autoimmune diseases, as is stress. So what comes first? I don't know, but an easy thing to do is add 2,000 IU's a day of vitamin D into your supplements, and then also supplement dietary with fatty fish, eggs, egg yolks, or foods that are fortified with vitamin D as much as you can. You almost can't overdose on vitamin D, especially in cooler climates and up north where we are, north and above. We don't get enough sun during the winter, especially. So, vitamin A. So, think green, red, and orange in your diet. Vitamin A is helps. It's part of your healthy skin barrier also, and so we want to add vitamin A into our diets. We can do that with all the fruits and vegetables that are red, green, and orange. And then add probiotics and prebiotics. So yogurt, sauerkraut, fruits, beans, all are prebiotic and probiotic for us in our gastrointestinal system. And keeping our GI system healthy keeps our body healthy. So every part of your colon is attached to some other part of your body. And so there's a lot of integrative medicine now knows that our gut health is related to our brain health and our heart health and all the other parts of our body. So do not underestimate how important it is to keep your gut healthy. And then magnesium. So leafy greens, nuts, spinach, legumes is really, really important to add into your diet as well. I think magnesium on this list is probably one of the most overlooked things. So please add it to your diet if you can. All right, nature. This is one of my favorites. So obviously working in healthcare, we don't get a lot of nature, right? So I want you to remember how important it is to be out in nature. I'm going to give you some statistics here. So nature lowers your blood pressure, okay? Nature can spur cancer fighting cells. In April of 2016, the Environmental Health Perspective said 12% lower risk of natural killer cells because you go out in nature. It also improves ADHD symptoms, and even fake nature is beneficial. So put some nature up on your screen if you can't get outside. Put some pictures of nature up on your walls if you can't get outside, because the advantages of being in nature are far underappreciated in our country. We should be out in nature anytime we possibly can. Sunshine. Okay, so sunshine helps us to do many, many things. Sunshine, I think, gets a bad rap because we think of sunshine skin cancer. Sunshine is extremely important for us. So, published in Neurology, they said that women under 40 had as much as 65% compared to those 65% chances, of getting MS than those who live in sun-drenched areas of the country. So think about that. So the rise of MS, they think, is partially correlated to whether or not you get sunshine, which correlates to vitamin D, obviously. So that's just one illness that they're showing where sunshine can help. Obviously, sunshine helps with depression. Sunshine actually helps with your sleep because it helps with your circadian rhythms. So the Journal of Clinical Sleep Medicine found that workers who got more light during the day by sitting near the window in their office, hopefully if you have a window in your office, slept better at night because it stimulates the serotonin in your body as well. Sunshine can also lower your body mass index, which I don't think a lot of people think about. And the reason for that is because the sunshine helps lower the cortisol levels so that the hormones don't get released that cause the weight gain. So 20 to 30 minutes throughout the morning and afternoon, especially of sunshine, help you to be more healthy. It also helps with your blood pressure. So published in the Journal of American Heart Association, analyzed more than 45 million blood pressure measurements recorded over 3 years and uncovered a clear pattern of lower systolic blood pressure in those people who were outside than when in the winter months. So sunshine, sunshine, sunshine as much as you can. All right. I'm going to give you a couple of things to practice really fast now. I'm looking at the time we have so we don't run out of time. Okay. So I can't see you all this. I'm just going to be honest with you. I really like to do this presentation in person much better because it typically is a very active presentation, interactive with the audience. But I can't see you, but you can practice this with me right now. So we're going to do a little bit of breathing and a little bit of imagery because mindfulness is very important in balancing your stress, in balancing your work, and in balancing your life. So everybody close their eyes. I can't see you, so I won't know if your eyes are really closed. What I want you to do is take what I call 3 deep cleansing breaths. And what you'll do is when you breathe in, you'll count to 5. Then you will hold the breath for the count of 3. And then you'll breathe out and count to 5. And so I'll walk you through a couple deep cleansing breaths. So breathe in, 2, 3, 4, 5. Hold, 2, 3. Out, 2, 3, 4, 5. Do 2 more of those, please. Okay, now I just want you to breathe normally. And when you breathe in, I want you to think be. And when you breathe out, I want you to think calm. So this should become a rhythmical breathing. In, think, breathe. Out, think, calm. And if you get distracted by something going on around you, just go back to be calm and continue your breath. And I'm going to time 30 seconds. Okay, take another deep cleansing breath. Keep your eyes closed. And now I want you to imagine that you're sitting by a clear creek and the water's running down. You are sitting on the bank of the creek. There's a light breeze. It's warm. It's refreshing. You can see the leaves on the trees. Some of them are falling. You can hear the birds outside. And as you're watching the creek bubble past you, the leaves start to fall. And some worries pop into your mind. I want you to take one of those worries out of your brain and put it on one of the leaves and let it float away. And if another worry comes, take it out, put it on a leaf, and let it float away. Continue to take the worries out of your mind, put them on leaves, and let them float away. You should start feeling lighter. Your worries are floating away. You're starting to be calm. Take another deep cleansing breath, and you can open your eyes. So hopefully that was calming. The breathing exercise you can use anytime, anywhere you start to feel stressed. The imagery you can use anytime, anywhere when you can get a private moment. So hopefully that was helpful. Other mindfulness things you could do, gardening, your hobbies are mindful. Okay, so practicing mindfulness is, I think, a lifelong skill we should cultivate and use. It also helps lower your blood pressure. It also stimulates your immune system. Meditation is extremely effective in helping our health. Mindfulness is like the precursor to meditation. So in 2017, the American Heart Association said that meditation can reduce heart disease. Another study showed that meditation increases the telomeres at the end of your chromosomes and the telomerase, which then helps with stress management and helps with breast cancer and other cancers and keeps you looking younger. So if you're less stressed, it's not just that your face looks younger, but your whole body stays younger if you're less stressed. Meditation in the Journal of Cognitive Enhancement showed that enduring improvements in sustained attention and response inhibition, so you were able to pay attention for longer periods of time if you became a person who meditated. So I say 10 minutes a day of meditation. Most people can't do 10 minutes when they first start. So start with 1 minute and work your way up. If you can get to 30 minutes, it's even better. So meditation. Yoga is another form of meditation, I think, and exercise. So yoga massages all of your internal organs when you do yoga. So it has health benefits. Yoga quiets the inflammation in your body. Again, health benefits. And yoga is easy to do. You can pick 5 yoga poses that you like. So just go online and find 5 yoga poses you like. You can do it anytime during the day when you have a break. You could do a yoga pose. Or you can do tabletop yoga. So if you Google tabletop yoga, you'll get poses you can do sitting at your desk if you're sitting at a desk all day long. Most people in healthcare do not sit at their desk all day long, but okay. Okay, digital detox. This is usually when people go, oh, because they don't want to give up their digital stuff. But I can tell you, we need to digitally detox. Very hard to do after the pandemic, right? We've all lived on our screens. Here we are again tonight, living on our screen. But if we can digitally detox, it's very important. So the correlation between social media use and the likelihood of anxiety disorder in 2017 was very high. I can tell you that is so outdated because in teenagers, ages 11 to 15, the suicide rate is up 188%. And they're linking it to social media and to the pandemic. So that's just kids. It's also up in adults, and social media and digital detox is so important. So David Greenfield from the University of Connecticut School of Medicine showed that our attention span for humans right now has dropped from 12 seconds to 8 seconds. 8 seconds is a shorter attention span than a goldfish. And he links it to social media or to digital use that we all have. It creates eye strain, it creates blurred vision. We're starting to see the shape of people's eyes are changing because of all the screens we watch. It's an addiction. Many people are now truly addicted. Many kids are truly addicted. 1/5 of people say technology is stressful. Most people are starting to have some form of neck pain and back pain because of all our screen usage. And we have elevated blood pressure if our screens are always on. So we really want to try a digital detox. And I love this slide. There is no Wi-Fi in the woods, but I promise you will find better connection there to yourself and to others. So I want us to all make a commitment to ourselves. These are some things you can do easily. So write a personal statement to yourself on how you will change your lifestyle, how you will balance your work life. Now, again, healthcare is a very hard environment to find balance in, but it's only going to happen if you make the commitment to yourself. Okay. All of us in healthcare, no matter what your job is, find that no one around us is going to tell us to go take a break. You have to take a break. I remember working as a nurse and I would go all day long and not pee. Why do you think nurses have UTIs? Because they don't pee enough. They don't drink enough water. They don't drink enough water because they can't go to the bathroom. Okay. We have to make the commitment to ourselves. And I very rarely will hear a manager say that they've reprimanded an employee for taking care of themselves. They usually follow them and take care of themselves as well. So you can be the leader in healthcare in your environment of saying, I'm going to take care of myself so I can be fully present to taking care of other people. So a personal statement can be 3 to 5 sentences of how you're going to do this in your life. We are much more likely to follow through if we write that statement for ourselves. Okay. You can share it with your boss if you need to. It might inspire them to encourage other people around you to do it. Review this commitment quarterly for yourself. Okay. And keep a chart if you need to. You can put all the things we just talked about on a chart and check them off as you're doing them. And then you start to feel good about it and you start to see results of having a better work-life balance. Okay. And please reward yourself. I am all about rewarding yourself for doing the right things in your life. And I don't know what that will mean, but for me, rewarding myself means buying a book I really want. I love to read. So I feel like Belle from Beauty and the Beast with the library. Okay. So for me, buying a book after I've taken really good care of myself is an important way for me to reward myself. You can come up with what is your reward for taking care of yourself. I also want to say something that a lot of people feel stuck in their job. If you're in healthcare and you're in an environment where you can't get work-life balance, I encourage you to think about, where can I go to get work-life balance? I'm hoping that, especially after this pandemic ends, that we become more and more proactive as healthcare organizations at encouraging work-life balance. It's been really hard over the last 2 years almost now to get work-life balance. But when we look at all the things that happen to us when we're not balanced, to me, it's a no-brainer, but it's not easy. And so I don't want to pretend that this is an easy thing to do, but the younger you start doing it, the easier it is. So, and the more we encourage one another in the environments to do it, the easier it is. So if we all do groupthink about being balanced in life and balanced at work, you will all succeed and you'll be happier in your work. So I know this is a brief overview of everything, but to me, there are all the things that I let fall by the wayside when I was overworking. All the things that I hear patients consistently tell me fall by the wayside because they're overworking, and all the things that the physicians and nurses and physical therapists that I see in my office say, I don't do that. So please try to add that in. Okay, so we're going to ask questions in just a minute. I do have references on the slide, so you can see the references. And I have more resources if people want. If you need to contact me for anything, my group practice is thewellnessplace.com. And so we have my practice, unfortunately and fortunately, is booked into January, but I have people who have immediate openings for 2 or 3 sessions or longer therapy if people need longer therapy. And then my consulting company is transforconsulting.com, which is where my future presentations, my first one coming out, I don't know how many of you need it, is probably going to be post-pandemic parenting. So that should come out after the first of the year, hopefully. But if you want to go to transformconsulting.com, I can put you on the email list for anything in the future as well. And I think it's going to be published to you as well after this. So I'm going to stop sharing my screen if I can figure out how to do that. Hang on. And go back to here. So, questions?
So Bree has one here. This is Pam. I know the stats at the beginning were through 2020 in the pandemic environment. How does it compare to pre-COVID environment, and what would a baseline be?
Hang on one second. I think pre-pandemic was more the first things I showed you. So like when I was showing you the behavioral consequences and the psychological consequences and the effect on the body, those were things people were reporting pretty regularly before pre-pandemic. I think, so I've been in healthcare since I was 20 years old, between 20 and 21. So more than 10 years, let's just put it that way. Okay. And I can tell you through all of my career and through all of my work with people in healthcare, stress and work-life balance are always an issue. They're probably at least 10% lower than those statistics I showed you on a regular basis, but it's always there in healthcare. However, the people I know who take really good care of themselves and work in healthcare, they don't experience that level of stress because they're putting in lifestyle changes. So I don't want us to ever fool ourselves that healthcare is easy, but if you are healthy, it's much, much easier.
Robin, Susan asked, will you email the slides to us? I unfortunately missed the beginning of the presentation.
I think the presentation is going to be put up for
it's recorded.
It's recorded,
yeah.
So it's going to be available. Yes.
So yes, so Susan, watch for that recording.
Mm-hmm.
Then Aaron asked, do you have any recommendations for apps or other tools to help you with meditation?
Oh, good. I'm glad you asked that. There's one app I don't want to forget to tell you about because I really like it. I gave a stress presentation to St. Ursula, and one of the kids told me about this really cool app. It's called Forest, Forest, like trees app, and you download it, and for every time you meditate or something like that, a tree grows. So it's related to social media and stuff. So that's a cool app. So look that up for that. Calm and Headspace are two absolute go-tos right now. I know Headspace gave to all healthcare providers, if you are a healthcare provider, you can go to Headspace and get free access to Headspace. They started that in the first few months of the pandemic, and I applaud them for that because it's not super expensive otherwise, but to give it to us for free because we work in healthcare, I really applaud them for that. So Calm and Headspace are great. So I think of guided imagery as a precursor to really meditating. So if you can get good at guided imagery and sitting in that wise mind breathing or that be calm breathing, then you can move to meditation.
Thank you.
Mhm.
We just bought one of those Oculus, and it
Oh yeah.
has
Yeah.
a calm and a focus. And honestly, when I first, well, you have to get used to the 3D thing
Right.
at first.
Right.
But I did the calm thing, and it did the whole breathing. They called it
Mhm.
box breathing,
Mhm.
4 4 4, and it was really actually very nice. So
Mhm. Yeah. I think once
uh,
you get used to taking time to meditate and to breathe well and do imagery, you don't ever want to go back because it's lifestyle changing, honestly.
Sharon Hill said, so good to see you and hear your expertise at work. I manage a team and I'm seeing major fatigue and less collaboration. I plan on sharing your points shared here. Thank you.
Yeah, good. I'm glad you're a manager of a team and you're going to share it with your team. So important. Yeah. And these are the basics of life, you guys. That's what when I look at it, I think, well, we all should know this. We all should do this, and we don't. We just don't. So,
So, Robin, how did your dance form your whole perspective on health? Because my daughters were dancers in high school and they were on the UC dance team, and we had 20 years of dance between three girls, and I just saw how they developed. And the food issue was sometimes a problem,
yeah,
um,
right.
because of weight, always watching your weight. But
Yeah. The food issue is a problem when you're a dancer. We can't avoid that, unfortunately. That's part of the reason I did not continue in dance. And I'm Italian. We eat. Okay. So I love food. Um, I love to cook. That's one of my hobbies. That's one of my stress relievers. I love to cook. So dance gave me a lot of self-discipline, I can say. So it made me dancing can be a very unhealthy lifestyle. So it really made me aware of the fact I wanted to take care of myself moving forward. So but I love the muscle memory. I can go dance anytime and it comes right back to me. It was meditative for me to be a dancer, and it gave me a lot of really good focus, and it taught me to set goals and achieve goals from a really young age. So just like a sport would be for a child, right? But
mhm.
a lot of people who are in the performing arts end up going into psychology. So I don't know if that
Really
says it
interesting.
all, but they do. So yeah. And the reason I became a psychologist rather than a physician is I really like variety. And so I can do a lot with my doctorate in psychology and my business psychology that if I was a physician, I would be more pigeonholed into one kind of specialty. So it
Right.
works well for me. Yeah.
Awesome. So, I'm Pam Greenstone, and I am the department head here, and we invited you all to come to this session tonight. We know how all our programs in the clinical and health information sciences, our allied health programs, respiratory therapy, medical lab, health information management, advanced medical imaging technology. Um, Everybody is being hit at, you know, at work, and there is a lot of stress. So we wanted to give something back to you. We also wanted to share with you that our students are experiencing this as well. And many of our students are working students on top of going to school, and it's really a crunch time. And so any insight you can give back to your programs as alumni would be really awesome. Be ambassadors, be mentors to students, just be encouraging to those programs, and connect back with us at UC, because once a Bearcat, always a Bearcat.
Yeah.
I have a degree from UC. I have 3 kids who went to UC, and once you're here and you're part of an alumni group, it's a great place to be, and we have great football
Yeah.
right now. So
Yeah.
please watch that as
Yeah.
well. We've seen our ups and downs, but it's really good right now. So um
Yeah, Pam, can
just
I say something?
yeah.
I will tell all of you that when I went back to school as a non-traditional student, and I was really fortunate to have a professor who said to me, you have to start meditating. You have to calm down and you have to get balanced, because I had children when I was going back to school, and it was very difficult. And I'll never forget my professors who really said, you have to take care of yourself. You have to be balanced. And it meant a lot to me because I had a lot of professors who weren't doing that. You know, they were pushing, 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 pushing. So if you can be that person in a student's life who may have no one else telling them, take care of yourself, I think that's a huge benefit to the students at UC.
That's a really good point. And many of our faculty in our department are doing mindfulness training and learning how to insert, even in online courses, how do you insert
Mhm.
mindfulness?
Mhm.
Um, so that is definitely on our radar, trying to teach and connect with alumni in this very stressful time.
Good.
Um,
Yeah. Thank you all very much for allowing me to share some knowledge with you that you can share with other people too, because we can really change how people look at work-life balance.
Thank you. Does anyone else have any comments or any questions about our department or how you connect with your program as an alumnus? Okay, well, thank you. Thank you for all coming tonight. Watch for the recording. We'll be sharing that recording. Please watch for other events that we will have, and share with your other Bearcat friends that this is here,
Yeah.
and we're really trying to develop an alumni connection here in our department. So thank
Okay.
you all.
Thank you.
Thank you, Pam.